Sustainable Development at Columbia University in New York City. The center was created in 2016 to help develop innovative solutions to reach the Sustainable Development Goals by 2030. The center is also the co-host of the Secretariat of the Lancet Commission on COVID-19, which was launched on July 9th. It is my pleasure and honor to be today's moderator for this webinar, which is co-hosted and co-organized by Taiwan's International Cooperation and Development Fund, Taiwan ICDF, as well as the Taipei Economic and Cultural Office of New York, TECO NY. Today's webinar will have 4 sections. In the first section, we will discuss how the COVID-19 pandemic has affected countries differently, and we will particularly look at the examples of Taiwan and Paraguay who have effectively suppressed the outbreak. In the second section, we will discuss life under lockdown and how science, technology, and innovation can bridge distances and bring us closer together. In the third section, we will discuss the post-COVID era and how to reduce the pandemic impacts and how to reboot the SDGs through STIs. And finally, the fourth section will be for questions and answers. And I invite you to submit all of your questions throughout the webinar so that our panelists can respond to them at the end of the session. You are currently watching on one of 3 platforms, either YouTube or the Facebook page of Taiwan ICDF or the Facebook page of TECO NY. There is a chat box at the bottom of your live stream. Please feel free to send your questions, and we will answer as many as we can at the end of the event. And all of the questions will be answered, even if we don't have the time, and the answers will be available on the Taiwan ICDF webpage. So to get us started, we will now start with the opening remarks from the Secretary General of Taiwan's International Cooperation and Development Fund, Secretary General Timothy Xiang. Timothy Xiang is the Secretary General of Taiwan ICDF. During his tenure as Section Chief and Deputy Director General of the Department of Economic and Trade Affairs at the Ministry of Foreign Affairs, MOFA, he actively worked on the legalization of Taiwan's foreign aid work, including Taiwan's International Cooperation and Development Act and MOFA's white paper on foreign aid policy. Ambassador Xiang was also Program Director of the APEC Secretariat and Taiwan's ambassador to the Republic of Nauru and State of Kuwait, during which time he was actively involved in promoting cooperation projects in various fields, covering education, medicine, clean energy, horticulture, and livestock farming. In the recent years, with Ambassador Xia at the helm, Taiwan ICDF has extended its global reach and international partnership, incorporating SDGs as a core strategy with the main aim of making a bigger impact in partnership for progress and sustainable development. Secretary General, the floor is yours.
And good evening, wherever you are. On behalf of the Taiwan ICDF, it is a pleasure to welcome you all to this webinar, a side event of 2020 United Nations High-Level Political Forum. Today's event involves 9 panelists representing governments, trade aid agencies, intergovernmental organizations, educational civil society organizations, and innovative financial institutes from Bangladesh, Paraguay, the Philippines, Taiwan, the UK, and the US. You will hear from a panel of a diverse experience and expertise, but with the same goal in mind, how to make a better world. During the opening of this year's high-level political forum, United Nations Economic and Security Council President Mona Joe said, the COVID-19 pandemic, while primarily a health issue, a health crisis quickly become the worst human and economic crisis in decades. It has exacerbated the already difficult situation for millions of people living in poverty. Indeed, in some places, lockdowns have slowed the spread of the pandemic, but also significantly disrupted daily economic activities. And while many are able to enjoy the convenience of online shopping, delivery service, and the ability to work from home or learn remotely, many more have lost their source of income, struggling to put food on table, pay rent, or access to medical services. Vulnerable groups, especially those who lack access to digital and online infrastructures, have fallen even further behind during the pandemic, and the situations are likely to worsen in the new normal of the post-COVID-19 world. The gap will increase dramatically if we don't do something now. That's why the SDGs, interlinked, universal in scope, and the focus on leaving no one behind will be more essential than ever during and after this crisis. Together, Taiwan ICDF, the Taipei Economic and Cultural Office in New York, and the Center for Sustainable Development at the Columbia University's Earth Institute are bringing to you the SET event on emerging stronger after COVID-19, science, technology, and innovation for sustainable development, to discuss and focus on the important role of science, technology, and innovation in combating the pandemic and in helping to accelerate progress toward the national development priorities and the 2030 Agenda for Sustainable Development. I believe this event itself, this webinar format, is a confirmation that through science, technology, and innovation, we can overcome the challenges posed by pandemics and other crises. And the complex development issues can be resolved through proven, tested means and partnerships. Drawing on nearly 30 years of experience, Taiwan ICDF has been sharing Taiwan's advanced technologies and promoting social and economic development in friendly and allied countries. And together with like-minded partners, it is our goal to contribute even more and create great impact to the international community. The Taiwan ICDF is a proof that Taiwan can help, and Taiwan is helping. I wish this webinar great success, and I look forward to a fruitful and inspiring discussion. Thank you.
Thank you. Thank you, Secretary General, for these opening remarks and reminding us that COVID-19 has deepened the inequalities, but that there is a role for science, technology, and innovation to help us in this fight. So while everyone is at risk with this virus, and really no one is safe, including presidents, the COVID-19 pandemic has hit countries in very different ways. And this is the theme of our first section. How has COVID-19 affected the world, and how are governments working to act to fight against it? So some countries like Taiwan and South Korea have effectively contained the virus and the spread without major disruption to the populations for their daily activities. And then you have the example of the United States and Brazil, in which that has not been the case. So it's interesting to note that actually Taiwan, South Korea, and the United States, they all reported their first case of COVID-19 within 36 hours of each other, around January 21st. Since then, the outcome has been very different. The US reported almost 3.5 million cases, and there is even a possibility that this may be 10 times worse than that, and over 135,000 deaths. In comparison, South Korea reported 13,500 cases and 289 deaths, while Taiwan only reported 451 cases and 7 deaths. So how did the same virus affect these countries so differently? Can we only explain this by the differences in the population sizes? So to understand how Taiwan successfully contained the virus, we are very fortunate to have with us our first speaker, Dr. Philip Loh, who will discuss the strategy on rapid containment, how Taiwan maintained routine daily life during the universal lockdown. So it is my pleasure to introduce Dr. Philip Loh, who is currently the Deputy Director General and spokesperson of Taiwan CDC, Center for Disease Control, and adjunct infectious disease physician at National Taiwan University Hospital. Since changing career path from clinical medicine to public health in 2008, Dr. Loh has been dedicated to controlling the HIV epidemic, as well as responding to emerging threats, including H7N9, Ebola, the Middle Eastern Respiratory Syndrome, or MERS, Zika, chikungunya, and most recently, COVID-19 in Taiwan. He is also a leading advocate in the Taiwanese government for HIV self-testing, the pre-exposure prophylaxis, or PrEP, and legal protection policies among key populations. Dr. Loh, the floor is yours.
Thank you, Yanis. Thank you, everyone, for participating. It's my pleasure and honor to speak with you, share our experiences in Taiwan. I have been personally involved in this COVID-19 response since day one, which was December 31st. And we are fortunate that we are still in a good position, that the society is not being affected to a big degree. Next slide, please. So here you can see in Taiwan, so far our school has remained open, restaurants remain open, shopping malls remain open. People are free to do these activities, wearing masks, remaining social distancing or partitions wherever feasible. And Yanis has mentioned, so far we have only a number of cases and 7 deaths only. And we have no locally acquired cases over the past 9 weeks. So we think we are in a very good elimination status, but it doesn't have any trade-off. So the trade-off is the border is only open to citizens and those with essential travel only. Although lockdown has not happened domestically, large social gathering has been allowed after June 7th. People are still uh, cautious about any possibility of a second wave of the infection. Next slide, please. So I think many people attribute Taiwan's success to early warning catch. So on December 31st, the New Year's Eve, we have actually were able to pick up alert through careful listening to whistleblowers and sought intelligence on our largest web chat forum called PTT. Here are some of these clips written in Chinese. Actually, the day before that day, the evening, Dr. Li Wenliang in Wuhan, China, posted a personal message regarding 7 confirmed SARS cases in Wuhan related to Huanan Seafood Market. And he also posted the laboratory result and the image findings. And these were passed on to our Taiwanese largest web chat forum. And the forum posted the first one at 2 a.m. On December 31st. I was able to find out that message around 5:30 a.m. and forwarded the message to our director's chat box. So all these social media messages were caught up very early in the morning, and it triggered a chain of reactions in Taiwan. Next slide, please. Here you can see some of the key events during the very first months of the response, locally and also internationally. Here you see WHO finally announced public health emergency, but at the beginning we were able to find out the message 1 month ahead and confirm human-to-human transmission in mid-January through sending 2 experts to Wuhan directly. Even before we had our first case in Taiwan, we already set up a central epidemic command center and started daily press conference to address the situation to the public. We quickly implemented a lot of travel restrictions and the ban of the entry for visitors from China. So that set up the tone for our early prevention and control in the response. Next slide, please. Another important story in the beginning was how we deal with the face mask crisis. After Wuhan lockdown in late January, the public demand in Taiwan for face masks surged up by 10-fold. And we had to ask all our manufacturers to scale up production of face masks in a 1 or 2 weeks time frame. And they were very cooperative. We provide incentives for them, and we also mobilize our military to help them in the production process. So the situation was finally government announced in early February that we wanted to purchase all the face masks locally produced and fairly distributed them to our people. Every week they were able to obtain 2 to 4 pieces based on their ID, and the cost was really cheap. In the early 2 months, they were only available at local pharmacies. And since April, we were able to produce a new system that people can pay online and pick up at a convenience store, which is more friendly, user-friendly to our younger generation. And let alone the public need, the healthcare facility are still our priority. So we provide all the necessary equipment, including fast mask, to healthcare facility free of charge. And the private sector were smart enough to create a mask map based on our open data. So people can easily navigate the amount left in local pharmacies or convenience stores and choose where they can go to purchase the masks. Next slide, please. Another important factor contributing to our success was the 14-day quarantine management, which is required for all citizens, non-citizens entering our border. So this also collaborates with a lot of technical sectors, and from airport to home, there were a lot of smart technology. For example, on arrival in the airport, people can use their smartphone to register in our quarantine system. And this data entered will be immediately linked to our civil and health services, which will monitor, supervise their 14-day quarantine in the community. In the community, when they are being quarantined, they also use smartphone app to report their fever or symptoms on a daily basis. If they don't report, we use the app to trace back to them and find out what's happening there. And there is also a way to make sure their compliance within the quarantine space. So their digital device will be linked to our police station. So whenever they are out of the range, an immediate message is collected by our police department, and the police department, civil services, health services will all be triggered to find out where the person is outside of quarantine space. Next slide, please. Another key message is, I think everybody will agree that public communication is key in this response. We need to let the people know the correct message, dispel rumors quickly, and also convey transparent information as frequent as possible. So since the beginning of the escalating response, the command center started to hold daily press conference every afternoon at 2 p.m. The commander himself and also vice commander, CDC director general, and a spokesperson, and a very distinguished professor. These 5 people will always sit on the press conference, report the number of new cases, their case investigation, their contact tracing, and the new policy to the people, live stream. So throughout these ways of public communication, also through comics and also social media, we have established a high degree of trust among the Taiwanese people. Based on statistics in April, the business sector in Taiwan agreed that 95% are satisfied with our efforts to control the virus. Next slide, please. So in conclusion, I think our success does not ensure future freedom of liberating from the epidemic. We are still cautious about where to go and how to get forward. So at the moment, we are cautiously opening our border. Although we still require 14-day quarantine, we have offered exception of shorter quarantine for those coming from lower risk countries or territory listed here. They are either subject to 5-day or 7-day quarantine, depending on the country they are from. And if they can pay to test negative for PCR on 5th day or 7th day, they're eligible to go out of the quarantine space and have a STI assisted managed visits for business. So we have been implementing that for almost 1 month. So far, among the 45 eligible visitors outside the shorter quarantine, no COVID-19 has been detected. We are still doing this risk assessment on a weekly basis, and we hope to continue this strategy until an effective vaccine is ready. That's my brief presentation. Thank you. Over to Yannis.
Thank you so much, Dr. Lo, for your great presentation on Taiwan's response. And it's actually very inspiring to see that this virus can be contained if you put in place these measures that you're talking about. First of all, early response. The second of all, availability and use of masks by the entire population, and then this quarantine management for anyone entering the territory, which is not happening, for example, in the United States right now. And finally, we're talking about effective daily communication. That was actually happening in New York quite well, both at the state level and in the city. And as a result, we were also able to get over the pandemic. So as a result, Taiwan never went into lockdown. This is obviously a very strong contrast to the experience that most of us probably on this webinar had in the last 4 months. But the good news is that it can be done. And I hope that many of us on this webinar will be taking some of these lessons as lessons learned. So our next speaker will give us a different complementary view of the response from the country of Paraguay. So I want to welcome Dr. Guillermo Sequeira. Dr. Guillermo Sequeira is an epidemiologist specializing in various areas of medicine and has a long career in the field of medicine in both Paraguay and Spain. He is a teacher and researcher trained at the National University of Asunción and has a doctorate in preventive medicine and public health from the University of Barcelona. He is the leading figure in the fight against COVID-19 in Paraguay. Dr. Sequeira, the floor is yours.
Thank you very much, everybody. I am glad to share our experience in COVID fighting in Paraguay for all you. Sorry for my English is not good, but let's try. Okay. Next slide, please. We share with you our different moments of this fighting. In January 23, we start with an epidemiological alert. The government start specifically our team, our surveillance team. We work in a big plan for the next month. The first protocols to work in the Minister of Health and from the public and the private sector of the health. Yeah? And we did the first recommendation for passengers to enter into Paraguay. Yeah? In February 26, the government declared the state of maximum alert. All the visa applications from Chinese citizens were denied. Passengers arriving from Brazil, Argentina, or Italy, or South Korea, they need to check a preventive measure and to do a quarantine for 14 days. In this moment, our country is the only one country in the region who was so strict for this measure. The quarantine for this country was very complicated to explain to all the ambassadors who they don't understand why we are so strong for this country. Yeah. And in February 28th, we did the confirmation of the we call the COE, the Emergency Operations Center. It's a task force with several government persons and person from the university, scientists, and from the economy, from the industry sector, food sector, because this problem is a big problem for the country. Yeah? In March 7th, we had the first case, detected. This first case come from Ecuador. Ecuador is a country that in this moment they tell for the world for the WHO that in this moment Ecuador say that they have only cases, imported cases. They don't have community circulation of the virus. Was in this when we say that we have a case who come from Ecuador, we stay again in a diplomatic problem. And next slide, please. And in our next case, in March 9, was another case from Argentina, And Argentina in this moment say for everybody that they have only imported case again. And we we have another diplomatic problem when we say that the countries, they don't say that they have community circulation. We receive person with COVID from these countries, and with this problem, we decide to understand. Probably we have Paraguay probably have the same problem. It's very difficult to say that you don't have a community circulation when your surveillance system is not perfect, it's not so good. It's very difficult to say that. Then we decide this next day, 10th of March, to do the first lockdown in all the region, in all the hemispheres, very day, some are not 2 or 3 days before the WHO declared of the pandemic in our planet. Yeah? And was a very difficult decision because we don't have the approval of the WHO region, the PAHO, and was very difficult to decide that. But we are in this moment we were in another epidemiological problem, a big epidemiological problem. In February and March was the peak of the one wave of the another epidemic in our country. That's dengue. Dengue in March and February was of 2020 was the biggest epidemic of dengue in the country in the last 10 years. Then we are fighting with another epidemic, and we are doing a lockdown for another epidemic. Was a critical situation. In March 13, all the reference price were established for health products. This was very useful. And in 10 days after that, we closed all our borders with neighborhoods and all flights to Paraguay and to go out to Paraguay. Yeah, only for humanitarian flights. Yeah? And in March 25, we did a lot of change in our notification in all of the surveillance sectors, and we start to increase our testing capacity for around 100 fold of capacity in around one month. Next slide, please.
Next slide, please.
And all this total quarantine, the first one was around 1 month and a half. And May 4, we start the go out of total quarantine, yeah, and start the phase 1. The phase 1 we start to reopen the industry in general, all the mechanics workshops, all the constructions, public and some civil works, service providers, individual physical activity, delivery service, and ontologies. Yeah, all the phases length around 3 weeks. The last week we review all the epidemiological situation of the first 2 weeks of this phase, and we decide together with this task force group and publication and doing publication daily updating of all of data and to decide the enter of the next phase. Yeah. The next phase is phase 2. We open the store up to 800 meters square on other professional support, sports, and cultural events without audience. Yeah, cooperative, office, construction, all the construction sectors, and We are now in phase 3, and we open in phase 3 all the shopping center, but without food court or playground, sport facility without audience gate, and other, gyms, but all this, okay, all this reopen was with us straight protocols, yeah. And the next phase we are talking about that is it's more dangerous, it's more risk. Yeah, we are talking about in this week right now. Next.
Dr. Sequeira, you have 1 minute left.
Okay. Yes. All for this 1 minute, I want to talk with all the communication support. The Minister of Health have a daily communication with all the community. And the next slide, please. I want to show all the technological support that Taiwan always is supporting to us to do all the IT support for to share not only for inside of the Minister of Health, mainly to share with the community to understand the dimension of the epidemic, and to understand to enter the next phases, and to understand why we are doing that or another thing. Yeah? I'm so sorry. I want to share a lot of things with you, and I'm here to wait in another question.
Thank you so much, Dr. Sequeira. This was wonderful, and it was really interesting to see that you are actually a success story. But it took a lot of effort, and particularly diplomatically, since you are a landlocked country and you have bigger countries all around you, trying to make sure that your efforts are not being derailed by maybe what's happening in the countries next door. So you are actually at less than 5,000 cases, I believe. So this is to be applauded. Okay, so this concludes our first session. If you have any questions, please make sure that you submit them now for the first two speakers, and then we'll try to address them at the end of the session. So unfortunately, Taiwan's experience or Paraguay's experience was not the experience of most of the countries. And in April of 2020, half of the world population was living in a country that enforced some sort of lockdown. While for some, the lockdown only had a minor impact, for many, it was highly disruptive. So in our second section, we will be discussing life in lockdown under COVID-19 and how science, technology, and innovation can bridge distances and bring us closer together. There is a saying that you might have heard of: necessity is the mother of invention. And this certainly applies to our collective experience under lockdown. So very creative solutions have been invented to respond to the problems that we can no longer be face-to-face, that we can no longer go to school, that we can no longer go to work, and that we can no longer travel, for example. So to get us started on this topic, it is my absolute pleasure to introduce our next speaker, Dr. Amit Chandra, who will present the work of USAID and how the COVID-19 pandemic presents opportunities for technology and innovation. Dr. Chandra is a practicing emergency physician and global health policy specialist. He has extensive international experience in the field of global health, providing clinical care, undertaking epidemiologic research, building partner capacity, and advising on health systems development. His health policy experience includes a 2-year post with the Millennium Challenge Corporation, a Fulbright Specialist Grant-funded project in Rwanda, and consultancies with the World Bank. He currently serves as a Senior Emerging Health Challenge Advisor at the U.S. Agency for International Development, or USAID. Dr. Chandra, the floor is yours.
Great, thank you so much, Yanis. Let me also start by thanking Taiwan ICDF for the opportunity to speak at today's event. It's an honor to be here and share a few thoughts and experiences on behalf of USAID related to science, technology, and innovation in COVID-19 response, despite the circumstances that we all find ourselves in. Next slide, please. So today I'll start by discussing USAID's global COVID-19 response, then share a few details on the agency's recently launched digital strategy and forthcoming digital health vision, And then I'll also share a few lessons learned during the agency's response to Ebola and Zika, and finally conclude with a few case studies of our current pandemic response in Asia, and all in under 10 minutes, I hope. Next slide, please. So first, a few words about USAID, that is the United States Agency for International Development. We lead the US government's international development and disaster assistance through partnerships and investments that save lives, reduce poverty, strengthen democratic governance, and help people emerge from humanitarian crises and progress beyond assistance. Since the start of the COVID-19 pandemic, the US government has responded by committing more than $1.3 billion in assistance to more than 120 countries around the world. In both health assistance and work in other sectors, the agency relies very heavily on science, technology, and innovation to achieve the goals that I've described here. Next slide, please. And as evidence to our commitment to innovation, this year, USAID launched its digital strategy. And the aim of this strategy is to improve development and humanitarian assistance outcomes through the use of digital technology and strengthen open, inclusive, and secure digital ecosystems. The focus of this strategy is on the agency itself, our implementing partners, civil society, partner governments, and the private sector. Next slide, please. And the strategy recognizes the immense potential of digital tools to help people live more free and prosperous lives, but also the threat they present to citizen privacy and data, freedom of the press, and individual expression. So as countries and partners adopt digital tools, equity and access concerns must be kept in mind. Consider the fact that 4 billion people in developing countries still do not have access to the internet. And women are, on average, 14% less likely to own mobile phones than their male counterparts, and 43% less likely to engage online. Next slide. So this strategy has 4 tracks of implementation, an ecosystem approach that assesses the digital capabilities of a partner country, work with implementing partners to realize the benefits and mitigate the risks of digital approaches, shifting USAID processes like payments and monitoring and evaluation to a digital by default approach, and building the USAID of the future by developing digital skills within our agency, both here in Washington and in our country missions. Next slide. And to bring this topic a little bit more specific to health and COVID-19 response, I'd also like to share a new document called the Digital Health Vision. So since the launch of the agency digital strategy, we've released a draft version of a roadmap to applying digital approaches to our agency's health sector programming. This digital health vision, which we hope to formally launch later this year, has 4 pillars to guide our work in global health. Investments in country-level capacity in digital health, strong national digital health strategies, global goods, including knowledge products and open source software tools, and finally, investments in digital health architecture. And a common theme throughout these pillars is to prioritize interoperability and prevent fragmentation as we support the launch and scale up of digital health solutions. And this strategy, these aims, arise out of some lessons we learned in our response to the Ebola and Zika outbreaks of recent years. Next slide, please. So in fact, we published a report on that topic in January of 2017, which shared many of these digital lessons learned. And it's interesting to note that several USAID-supported innovators who responded to past outbreaks have now adapted their solutions to working on COVID-19. So in past outbreaks, our experience was that too often the critical data and information needed was inaccurate, missing, or simply didn't exist. The majority of data and information flows in the early days of the Ebola outbreak moved through word of mouth, analog or paper-based channels. And this led to a fog of data that one can imagine through this image that I have on the slide here, which is a mapping exercise conducted by the Liberian Ministry of Health of the various data sets that were critical to inform their response. The 2017 report reflected on these experiences and highlighted opportunities for digital health related to both pandemic preparation and response. And this includes extending digital connectivity, countrywide ICT assessments, and prioritization of interoperability across all partners. Next slide, please. And here are two examples of USAID-supported digital innovations launched to respond to prior outbreaks that are now being deployed as tools for COVID-19 response. MHero is a two-way communication platform that connects health officials with frontline health workers using local platforms and channels. With this open source tool, ministries of health can send out critical information, and frontline health workers will gain knowledge, skills, and confidence in order to test, diagnose, and treat cases, also to take care of themselves and engage in prevention work. Originally developed for the Ebola outbreak, the intervention was deployed in Sierra Leone, Guinea, Mali, and Liberia. The tool was recently deployed in Liberia to dispel COVID-19 rumors and to distribute public health information. ComCare, originally designed for Zika response, is a digital health platform that equips frontline health workers with mobile solutions that support contact tracing, data collection, decision support, and information dissemination. And interestingly, this app, this solution is currently being used in Asia, Africa, and here in the United States. Next slide, please. And I'd like to conclude with just a few examples of how USAID COVID-19 support programs in Asia have included digital solutions by design and out of necessity due to the global lockdown. In India, we have used remote learning tools to provide COVID-19 risk mitigation and prevention training to 38,000 health workers and 600 healthcare facilities. In Central Asia, we've used online learning tools to support civil society and media engagement to counter disinformation. And in Cambodia, USAID is scaling up tools to facilitate distance learning for students with a focus on the children of returned migrant laborers. And we are also providing IT support to facilitate government contact tracing efforts. Next slide, please. So here are a few additional resources and links to the documents that I've mentioned in this presentation. So hopefully when this is shared, you can dive deeper into all of these documents. And even if you're looking now, you can ask some questions and I'm happy to answer them. And final slide, please. And I'll conclude there, back to Yanis. Thanks once again to the webinar organizers, and I look to sharing more details during the Q&A. Thank you.
Thank you so much, Dr. Chandra, for your great presentations on all of the opportunities that science and technology can provide in the fight against COVID-19. So in a world that is pushed more and more to social distance, smart technologies can help us stay connected, not only to our loved ones, but also to our work and also to help people who are in need. I think it's important when you noted that, we don't need necessarily to reinvent the wheel, and a lot of these solutions have already sort of been invented in past epidemics, and you were noticing Zika and Ebola. Actually, our team has worked with ComCare on Ebola in Guinea, so we are quite familiar with that. So social distancing is an effective way to combat COVID-19. Another one is frequent hand washing, and I hope that for most of us this has now become second nature. But how do you carry out this protective measure when you don't have access to clean water? So our next speaker will discuss access to sanitation, hygiene, and menstrual health in the context of COVID-19. So I want to warmly welcome Mr. Patrick England. Patrick England is a Knowledge Management and Innovation Support Officer with the Water Supply and Sanitation Collaborative Council, or WSSCC, He supports learning and documentation across the WSSCC-funded programs in Sub-Saharan Africa and Asia, focusing on behavior change for latrine use and hand washing, equality and non-discrimination, safe management of sanitation services, and local wash governance. Mr. England, the floor is yours.
Hello? Okay. Sorry, can I confirm, Yanis, if you could see my screen?
Yes, I can see your screen.
Great, thank you very much. So great, thank you very much, Yanis. My name is Patrick England with the Water Supply and Sanitation Collaborative Council. Thank you very much for ICDF for inviting me today. I'm going to be talking about technology and innovations in wash for health emergencies using a case study from Nepal about how they used mobile data gathering to assist in the country's COVID-19 prevention response outreach, and how that mobile-based monitoring built on top of the country's previous sanitation campaign. So just a quick word about WSSCC. It's a membership-based wash organization based in Geneva, Switzerland, hosted under the United Nations. And we are recently, as of next year, transitioning to the Sanitation Hygiene Fund. And the purpose of this fund is to fill the global void in the international response to the sanitation, hygiene, menstrual health, and hygiene gap. Now, to get a sense of what this gap is, here are a few very alarming statistics. We have approximately 1 in 2 people globally not using a safely managed sanitation service. 1 in 3 people lack basic hand washing facilities at home. And quite startling, 70% of healthcare workers do not routinely practice hand hygiene. So while the immediate focus of the world today is on COVID-19, for the wash sector, we very much keep in mind that there has already been a global health crisis due to several preventable diseases, namely diarrheal diseases, in many settlements around the world due to poor wash services. So as Yanni has mentioned, and one of the key focuses of the Sanitation Hygiene Fund will be on hand washing promotion. And as we know now, this is a key aspect for preventing the transmission of COVID-19, as well as a host of other different diseases. And this has to do with access to facilities to some extent, taps and accessing soap, but it's also really about behavior change and ensuring that healthy hygiene habits are fully instilled in communities. The Sanitation Hygiene Fund will also target the most vulnerable people. And as we know, and we've seen how this has been affected in the United States and Britain and other parts of the world, is it's the most vulnerable that are the most likely to contract and die from COVID-19. In the context of wash, this is due to less likelihood for these individuals to access adequate wash services, partly due to their use of shared and communal water and sanitation facilities. They're more likely to be affected by underlying social health conditions, unable to cope with lockdown or practice social distancing effectively, and receive public health information in a timely manner in a way that suits their needs. So a key priority for the wash sector for during the COVID-19 era is on better data collection to help with the sector's prevention response. But this does need to, there's an agreement that this does need to rest on 2 key planks. First, that this has to be built on already existing systems, and with an eye for ensuring sustainable wash services for the future. Second, communities have to take the lead. This is one of the key lessons that we've learned during the Ebola epidemic, where the erosion of trust between communities and health service workers over the course of decades really hampered sufficient response. Communities are often the best place to identify those that are the most in need and are able to provide solutions that make sense. So with that being said, I'd like to just talk quickly about an innovative case from Nepal. A bit of background information about what happened in Nepal. Previous to the when COVID-19 came to the country, Nepal actually declared themselves open defecation free September 2019. And to get an indication about how rapid the success of that campaign was, you could see that in the 2000s, at the start of the MDGs, it was less than 40% of the population had access to an improved toilet. This accelerated throughout the years, and the green line is from government data and the dots are from sector household surveys. And starting in 2011 and up to present, we've now achieved close to 100% of the population using an approved toilet. So quite a successive, rapid campaign. And the success of this sanitation campaign had to do with three key factors. The first was the emphasis on strengthening local government coordinating bodies, WASH coordinating councils at the local level that were really able to bring partners together, coalesce efforts around common targets and indicators and approaches. The second is on local resource leveraging, not only about contributing financing towards the campaign from local governments, but actually setting up dedicated sanitation hygiene budget lines. And third was the mobilization of a broad cross-section of community groups, women's groups, forest users groups, religious organizations to allow the campaign to reach such a rapid scale in a short amount of time. WSSCC is still supporting the second phase of Nepal's sanitation campaign, and that program is executed through its partner, UN Habitat. The key districts that we're focusing on are on the bottom map, those hatched districts, which is called the Terai, which are populated by very low-income communities characterized by seasonal labor, lots of prone to flooding during monsoon season, and a large population of indigenous groups who don't always speak Nepali, particularly older women, and marginalized ethnic groups, or scheduled caste as they're called in India, from the Dalit groups. So the first recorded case of COVID-19 occurred in Nepal in January, and lockdown started on at the last week of March, early April. And it's worth noting that the program is not set up as an emergency response program, but like all development partners, we've had to very rapidly find new ways of working, particularly in a lockdown situation where normal methods of visiting houses and community meetings wouldn't work anymore. So in response, UN Habitat and their partners developed a mobile-based survey and messaging system that builds on those key strengths that were built during the sanitation campaign. The survey and messaging system covers almost 57,000 households across 16 districts since May. A very short amount of time, but covers quite a massive chunk of the population. And it's conducted by over 1,000 community volunteers, many of which were facilitators. The system basically collects data on prevention awareness, on household members exhibiting any COVID-19 related symptoms, hygiene behavior, what's going on in the household, as well as their access to services, which includes hand washing facilities, latrines, toilets, as well as mental health and hygiene products and services. That data is then fed back into strategies by the local governments for more targeted outreach efforts. And one key thing that we've learned is that these calls are quite important for the mental health support for vulnerable groups. To have these survey and messages delivered by a familiar voice in a language that many of these communities understand was quite helpful and reassuring, especially when they know that COVID-19 prevention can be done through very simple steps such as hand washing, social distancing, and to help dispel any myths and rumors around the disease. Just very quickly, the tool that they use is called Pogo Toolbox. It's kind of a standard tool. I think it's really familiar in the development sector. And this isn't an advertisement for the service, but if you're interested in what's being used, feel free to check it out. It's basically a mobile-based platform where users can input their data, send it to the cloud, and have it processed and analyzed later down the line. So how this system works is that UN Habitat, the executing agency, develops the messages in the surveys at one level and passes them on to their local NGOs that work at the district level. Based on their existing network of community volunteers, those survey and messages are delivered by telephone about 20 households a day. And the reason why they can do that is because they were facilitators working on the previous sanitation campaign that compiled all this household information. So it's quite easy to collect all that, those telephone numbers very quickly and deliver these surveys. That data is then passed back up the line through the Pogo Toolbox to UN Habitat, where it's then passed to the local governments. And oh, sorry, I'm hearing something.
We're getting feedback.
Yeah, I'm getting feedback from somewhere. I hear that as well.
If you're not speaking, please mute your phone, your line. Thank you.
Okay, sorry. That data is sent to the COVID-19 Palika level, which is the local government COVID-19 Prevention and Control Committee, which uses that information to better target their prevention responses, which includes better hygiene behavior change messages, additional prevention information, additional supports for vulnerable groups. If there's a household that says that they're expressing some of the symptoms of COVID-19, the health department of the COVID-19 Prevention Control Committee can help direct them to the assistance and information that they need.
You have 1 minute left. Sorry, you have 1 minute left.
Yeah, so these are just some of the, I just threw up two examples of some of the results that the system has gotten so far. Basically, the key story here is that, for the population that, doesn't have sufficient knowledge of COVID-19 transmission, or they don't have a hand washing facility at home, that's where the local government through the response center would direct their resources and support, which is drawn from the sanitation hygiene budget that were established during the sanitation campaign. So that can include follow-up calls, material support if needed, all different measures to help support those vulnerable households. So to quickly wrap up, I'll just chuck out some reflections that we've had over the course of this system. And for us, it was really vital that technology builds on existing systems and aims to strengthen sustainability in the long run. This wasn't a technology that was just slapped on top of a response effort. It really was built in and integrated to the existing structure the sanitation campaign was building for the past 10 years. Key do no harm principles are absolutely essential when it comes to technology, when it comes to confidentiality and the right to privacy, which is something that I know the program is strengthening. And it's also key to ask, how do technologies exacerbate existing inequalities or create new ones? And how are communities involved? And finally, my last point is simple, low-cost technologies are often the best suited for these situations. The Pogo Toolbox is something that's well known, but at the end of the day, it became interpersonal networks and telephone calls that were allowed the program to access a large number of households and feed that information. Thank you very much, everybody, to ICFD in particular, and a big shout out to my colleagues in Nepal. They're really killing it down there, and much appreciated. Thank you.
Thank you so much, Mr. England, for your great presentation on the access to sanitation and hygiene in the context of COVID-19. So a simple gesture that we all take for granted, such as hand washing, can be a real challenge for vulnerable populations, and not just in low-income settings, also in middle and high-income settings, if you think about migrants and refugees, for example. The example of Nepal shows that the adequate use of technology, when linked to an existing program, such as the National Sanitation Campaign, can help collect valuable data, which can then be used for adequate policies. So most of us are familiar with technology for data collection and have probably used or even developed tools like that in the past decade. But life under lockdown has forced the rapid development of technology for online education. In a time when most schools are still closed worldwide, how do you ensure that children are not falling behind on their education? So our next two speakers will discuss e-learning and distance education under lockdown. So they will be speaking together in the same presentation, and I want to welcome Cecilia Soriano and Enamul Hock. Cecilia Soriano works as Programs and Operations Coordinator at the Asia South Pacific Association for Basic and Adult Education and is based in Manila, Philippines. She assists education coalitions in India, Nepal, and Indonesia in their education research, policy advocacy, and campaigns. Soriano has been active in education reforms since 2000 after the Dakar Declaration of Education for All. And Mr. Enamul Hock is Deputy Director of Campaign for Popular Education, a network of NGOs, academics, researchers, and education campaigners working in the field of education in Bangladesh. He has more than 22 years of experience in the education sector and has a good understanding of the sector's policies, plans, and financing issues, and works closely with concerned government agencies. He's also engaged in promoting ICT for education and education in emergency and humanitarian response. The floor is yours.
inviting us to this webinar. We are pleased to present two cases on how the education sector is harnessing technology to ensure continuing education, as well as in promoting dialogues among young people. We will also share key challenges in online and distance education given the realities of marginalized communities. Next slide, please. Let me start by citing a few insights from the global online survey conducted by UNESCO in April and March, which gathered responses of education systems given the context of the pandemic. The survey received a total of 100 responses covering 61 education systems from 59 countries. In response to school closure, most education systems introduced distance learning programs using various media such as TV, radio, and the internet. Education systems raise concern on distance education, such as issues on equity, access, and quality. On access, 87% of education systems were concerned about unequal access to ICT at home. Countries also reported challenges in access to textbooks, reading materials, TV, radios, as well as open educational resources. With regards to equity, countries raised concern on disparity in access between urban and rural remote areas. There are also concerns about access to mobile phone, ICT, and the limited access of women and girls to this technology. The countries also cited that they are facing challenges in providing quality distance education to learners with disabilities, migrants, as well as refugees. In terms of quality, the survey reported skill gaps in using distance education across most education systems, regardless of income. 80% responded that parents or caretakers might not have requisite skills to facilitate home-based education. 64% of the respondents said that their teachers do not have the necessary skills to facilitate distance education. Finally, 48% of the education systems reported that students might not have the skills for online distance learning. To give us an example of how an education system is attempting to address these challenges and transitioning to online and distance education, I would like to give the floor to Enamol Hook of Campe to present the case in Bangladesh. Enam?
Yeah, next slide, please. Yeah, good morning and good evening. I'm Enam from Bangladesh. In Bangladesh, about 40 million learners are directly affected by the COVID-19 due to school closures since 18th March. And many of them are traumatized and there are big learning loss. Bangladesh was making progress during past 2 decades, and that has been slowed down. And there are limited access to technology, particularly for the most marginalized. The government of Bangladesh has taken some stimulus packages. Those are mostly focused on economy and livelihood. In education, in emergency response, it is relatively limited, and there are inadequate interventions dealing with the trauma and stress, about the learning loss, and reaching the most marginalized. So two issues. One is how we continue this during this pandemic and how we prepare for post-COVID new normal and promoting back to school programs. So Campe as National Coalition, we have carried out a survey on 115 NGOs and 11 teachers associations. Next slide, please. The survey shows that about 2.76 million learners supported by different NGOs have been affected by the COVID, and about 53% of them are girls. And there are about more than 50,000 education institution or learning center are directly affected. We are asking some question how they are dealing with the learners and parents, and it shows that there were half of the learners and parents were communicated over telephone, and about 32% of the respondent carried out some campaign using some local cable networks, and about 13% of them provided some supplementary reading material so that they can continue their learning at home. Next slide, please. So the survey also highlights some of the challenges. The most important challenge is economic hardship, which may result in increased absenteeism, irregular attendance, malnutrition of children, child labor, and children engaged in household work. Many of the children will be drop out, and child marriage may increase, and that followed by early pregnancy. So the limited accessibility to the digital alternative platform is another key issues, and there are inadequate space for learning, particularly in the slum areas. Can we go to the next slide? I'd like to skip other point. Yeah, so if you look at the first case was detected in Bangladesh on 8th March, and immediately after that on 12th March, the global pandemic was declared by WHO. And 18th March, all the schools in Bangladesh has been closed. And 29th March, Bangladesh started distance education through television. And from 13th April, they started online content sharing, and many of the partners, many of the actors has contributed to that. And from the 15th of May, they have launched EduHub, which is a flagship program at this moment to promote online learning. Next slide, please. So the key solutions have been identified through 4 different modalities. Number one is highest coverage through television. About 56% of the household has television, and that followed by internet. Although we have less number of computer and less number of internet accessibility, but still it has been promoted highly and considered as an opportunity. Beside that, we are trying to explore intervention through radio and intervention through a mobile phone and a smartphone. The good thing is about 95% of the household has kind of phone. It could be feature phone or smartphone, but the concern is it is belong to the elderly people, and they need to go to the work, and the children cannot get access to the mobile phone. So in such situation, how we can move forward? That is one of the critical question. Next slide, please. So these are some example that we have one portal called Connect. It looked into the mainstream education. Then we have skills portal, which deals with the technical and vocational education, and the new EduHub. So if you look at the right hand side on the below, there are so many partners, about 25-6 agencies have contributed to this national effort. So it's a collective effort by the state and non-state actors, and everybody is sharing their content free of cost. So this is a good example that how actors or stakeholders can engage during the pandemic and try to help the state to overcome the situation. Next slide, please. So beside our mainstream area, Bangladesh, many of you might be aware about Bangladesh is host of the large number of Rohingya refugees. So they have some different system. It is much more organized than the mainstream one. So there are so many modalities, including radio programming, learning management system, interactive voice response, short messages, educational games, and WhatsApp messaging group, among others. So it is much more coordinated in a small scale, but the other one is large scale. Can we move to next slide, please? So how we see ICT as an opportunity through our rapid response survey and follow-up consultation and working with the government, particularly under the Prime Minister's Office, access to information, and a local consultative group and education cluster, along with other actors, we find that ICT can help in system strengthening. We can revisit our curriculum and assessment, and we can also track individual learners' performance. We can use ICT for capacity building of teachers and education administration, and transform our education system and reduce dependency on commercial coaching and private tuition. So some of the key recommendation from the civil society, and the major actors include thinking of an education recovery plan to resist or retrain the loss which are anticipated, and follow the school opening guideline provided by the World Bank, UNICEF, UNESCO, and WFP. Continuity of the complementary activities after the pandemic, the initiative taken using 4 different modalities. How can we carry on even after the pandemic? And integration of ICT and promote blended learning. So after the pandemic, the entire globe will have a different kind of education system. How we can adopt with that, that is one of the key issue. And to that, we need to strengthen institutional partnership and collaboration with actors at home and abroad, and learning through the research and innovations, as well as learning from neighbors. And doing all those, we need to protect the education gain and allocate minimum 15% of national budget for education, and which needs to be supported by a targeted resource allocation, particularly what we are telling that only 55% of the learner can reach through television, and those who cannot get access to technology, they are the most marginalized. So we need to think about hardcore poor, girls, and ethnic group, and people living in remote areas. So we need to think about creating a network of technologies, network of ICT platform, and all that in schools across the country have high speed internet, and all the teachers are equipped to use ICT in their teaching learning process. I'd like to request Thea to move forward.
You have 1 minute left.
Thank you, Anam. And for the 1 minute, let me just share that the young people are also using technology to promote dialogues among young people in marginalized communities. And ASBE, together with youth organizations in 9 countries, have been conducting youth-led action research to investigate the impact of COVID-19 on the education and well-being of the youth, especially those in marginalized communities. And the 9 countries are on the slide. If you can go just to the next slide, just one more slide. And in Mongolia, you can see from this photo that based on the youth-led action research, students who live in rural areas have to climb up to the hills to find better internet connection to study. And these are some of the recommendations that were presented by the youth researchers, but these are not, this is not an exhaustive list because they're still doing their work. So just to say that the young people also conducted local actions such as awareness raising, using watch parties to promote dialogues among young people, to talk about wanting to see their friends and their classmates, and also to talk about their anxiety about education and their well-being. So I would like to stop here and share with you that the young people are also doing some interventions using technology to promote dialogue among themselves. Thank you.
Thank you so much, Ms. Soriano and Mr. Hawk, for this presentation on the exciting innovations that are coming out of the education sector, and particularly to show us the examples coming out of Bangladesh. So this concludes our second section. If you have questions for any of the previous speakers, please send them now, and we will respond to all of them, some of them at the end, and then all of them in due time. So many of the innovations that were presented in the first 2 sections, either to fight the disease or to adapt to it, were developed so we can try to continue our lives until things go back to normal. Is that even going to be possible? There was a time between January and March where we really had a slim window of opportunity to stop the pandemic, like what we did with SARS back in 2002 and 2003. But I think that we have now entered a new stage where we have to learn to live with it in what we would call the new normal. So this is the theme of the 3rd section of this webinar. We will be discussing the post-COVID-19 era, how to reduce the impact of the pandemic and reboot the SDGs through STIs. So to get us started on this topic, it is my pleasure to introduce our next speaker, Dr. Pai-Po Lee, who will discuss post-pandemic resilience through STI, practice in education, health, and food systems. Dr. Lee is an expert in international agriculture, human resource development, international development cooperation, and the third sector, international NGOs and NPOs, who has devoted himself to international cooperation and development programs for over 30 years. He has been in charge of many Republic of China international cooperation and development services, including investment and lending programs, overseas technical missions, overseas volunteer capacity building, and human resource development. Through project surveys and appraisal, assignments of expert project supervision and evaluation, he plays an important role in designing Taiwan's ICDF foreign assistance strategy. Dr. Lee, the floor is yours.
Thank you, Yanis. Yeah. Next one. Good morning, good afternoon, also good evening for all. It's almost midnight in Taiwan. I very pleasure to present the pandemic resilience through STI, practice in education, health, and a food system. The four sections I like to present. The first one, the impacts of the COVID-19 on SDG and the response strategies. STI section 2. Section 2, Section 2 of the STI practice for the better resilience while achieving SDG. The third section, science, technology, innovation cases. Conclusion of next. So from the section 1, the COVID-19 on SDG and response strategies from the COVID-19 impact for global people and the economies is a setback in SDG with cross-sector issue. The proportional impacts on vulnerable poor people. The advantage of a Taiwan model. I quite agree with Dr. Low to mention about the Taiwan model. We provide also to achieve that comprehensive and connect ecosystem, smart technology, public-private people partnership, 4P, also the shared experience with through international cooperation. So the Taiwan ICD strategies to 2030 is well integrate 5 major core sectors in agriculture, focus on the food security and rural development, the public health, learning capacity building for education, good governance in ICT, climate change, sustainable environment, also economy development and global partnership for all. Next. So the STI practice for better resilience while achieving SDG. There are 3 major pillars: digital environment and capacity. Second one, the digitalized information and data. The third pillar is diversified application. Next. In terms of the digital environment and capacity, I'd like to raise one project entitled the Application and Information Communication Technology for Education Development in St. Lucia. We help the 2 primary school and 4 secondary school in building smart classrooms environment, inspiring teacher engagement, enhancing digital capacity, also establishing online educational platforms. You know, this the ICT for development, also ICT in education in St. Lucia and East Caribbean country. Next. So the digitalized information and data. The project's health information management efficiency enhancement project in Paraguay. The project's members to introduce the health information system, or HIS, digitalized health and medical records, links the hospital information to national health system and developed case tracking function and as well as developed teleconsultation function in HIS for social distancing. It's just get help will help for the NCT and communicable disease patient. It's very helpful. Next one. Now, the other one, diversified application. When Taiwanese volunteers utilize GIS skill to help the monitor disease, such as dengue fever and COVID-19 and intervention in the COVID-19. So from the dynamic figure can identify which countries could be the confirmed cases, how about the numbers. So the GIS is ready to help aggregate and integrate data into one database. Also change the way GIS data is correct in the process. Also enhance data visualization for analysis and planning. Provide capacity building in GIS knowledge in the modeling. Next one. Next. So also the other projects in Paraguay had should be fingering, breeding, and a cultivation project. This surabi is one kind of the freshwater fish. The Taiwan Technical Mission provide online application platform to building connection between agricultural producer and the consumer during the lockdowns. So they easy to identify the market, also the location of this surabi fish. Apart from this fish, the other one, for instance, dairy, honey, fruit, and vegetable is also including that. Next one. So the global partnership categorized by the pandemic, according to the SDG implementation, that's the since 2015 about the Addis Ababa for the blended finance. The financial sector, the financial tool for economic, the reactualization of the COVID-19. So this later on, IIX will be give the more informed in terms of WLB. Also in Paraguay, we have the cooperation projects with Paraguay Foundation to provide soft loan for the benefits corporation. It's just to focus on the social impact. Next one. So also the global partnership, the Taiwan ICDF joined the CABES for the emergency support and the preparedness program for COVID-19 and economic reactivations. We allocate 2 projects, one for credit to finance public sector operation, including government public sector institution. The other one, financial sector support facility for micro, small, and medium enterprises. So this including the public-private bank, also online financial institution, cooperative, and the savings banks. Also invite the bilateral and multilateral organization to join this one. So based on next one, based on that the information, I make the short conclusion in terms of comprehensive strategies to engage in assistant partner in building digital platform and capacity, making use of data, applying STI and the post-COVID-19 eras. Design the cross-sector solution to enhance the total resilience. Also to supporting the proactive approach for the financial institution, also MSME, and the SDG tool for the STI development, as well as the SDG implementation by 2030. The global partnership, I also mentioned that the sharing the best practice and the 4P, as well as the bilateral and the multilateral development partnership. Thank you for your attention. Thank you.
Thank you so much, Dr. Lee, for your presentation on how we can reach the SDGs using STIs, even in the context of the post-COVID era. It's evident that 2020 will be will have a major global impact on our ability to reach the SDGs by 2030. And to some extent, it's almost as if we all will lose collectively a year. So as discussed during the opening speech by the Secretary General of ICDF, COVID-19 will reverse years of progress and deepen major inequalities. For example, gender inequalities. Women worldwide have suffered dramatic consequences due to COVID-19, such as increased gender-based violence under lockdown or increased economic inequalities. So our next speaker will discuss how to mitigate these economic inequalities with her presentation on innovations in women's economic empowerment. I'm very glad to introduce you to Professor Doreen Shahnaz. Doreen Shahnaz is the founder and CEO of Impact Investment Exchange, IIX. As a pioneer in social impact, Professor Shahnaz has led IIX to create the world's first social stock exchange, the largest crowdfunding platform for impact investing, and innovative financial structures such as the Women's Livelihood Bond series, which she will present right now. For her pioneering work, Professor Shahnaz received the 2017 Oslo Business for Peace Award, which is the Nobel Prize for Business. She is also an advisory member of UNDP, the World Economic Forum, and she is a TED Fellow. Professor Shahnaz, the floor is yours.
Great. Thank you, Yanis. Thank you for that kind introduction. A very hearty thank you to the Taiwan ICDF, and also a big thank you to Dr. Lee for mentioning our work in your speech. Really appreciated. Good evening, good afternoon, good morning to everyone who's on the call. So it's 11:30 in Singapore, where I'm based. So I apologize beforehand if I start getting a little tired in my presentation, but it is short. So it's wonderful to have this opportunity to talk about our work, and then also really talk about an important group in this planet, which is women, and then also how we are actually addressing COVID situation and making sure that women remain sort of front and center of our work of putting them in the financial markets. So let's get started. Next slide, please. So very quickly, so what is IIX? We stand for Impact Investment Exchange, and we're a leader and a pioneer in the impact investing space. And we've been around for now 11 years, and we have really set out with a goal to transform the financial system so that women, environment, and the underserved communities are really part of the equation, that we actually give a value to their voice, and we effectively, as we like to say, we connect the back street to the Wall Streets of the world, while of course achieving the SDG goals. So it is fantastic, and I'm very proud to say that we have been able to do that. And to date, IIX's work has unlocked over $200 million of investment capital, and also it has impacted over 80 million lives. And most importantly, our work also expands across Asia Pacific and the US, so impacting over 46 countries. So next slide, please. So the Women's Livelihood Bond that Mr. Lee alluded to is one of our very innovative products. And we have been doing this Women's Livelihood Bond. We actually structured it. It was a very, very funky structure using very sophisticated finance, but really showing that finance can be used effectively for the underserved market. And it is designed, again, I won't go into the details of it, but it is designed to make basically loans to high impact enterprises under a very interesting CLO structure. Now, we made history in 2017 when we launched the first bond, because it was not only the first bond ever in the history of capital markets, the 800 years of the history of the capital markets, to have a bond focused on women to be listed on a stock exchange. But it is also the first social bond to have been listed on a stock exchange. And it also was a first multi-country, multi-sector bond. So it was really first of many things. But what I'm really proud of was the fact that we put women on the stock exchange, and for the first time, in 800 years, we were able to actually give value and a voice to the women's work, which is really focusing on the livelihood. We brought out this WLB2 end of last year, and we are now working on the Women's Livelihood Bond 3, which I will touch on later on. So with this innovative work that we have done, we have received quite a number of awards. And we received the P4G, Partnership for Growth State of Art Award, which is a UN related award. We got this at the UN General Assembly last year. We received the UN Global Climate Action Award last year, and we also received the Global Wealth and Society Award from Indonesian government last year. So we're very proud of all the acknowledgement, for this very important work that we're doing. Next slide, please. Now, the Women's Livelihood Bond is not, I cannot say that IX can take the credit for it, because it really does take a village to bring something together so complex, so sophisticated. So we really have an incredible opportunity to bring together a group of partners who have played an incredible role in this bond. So we have the US government, USAID, which is actually providing the guarantee. We have the Global Affairs Canada, we have DFAT, the Australian government, who are all sort of playing various roles in enabling us to structure the bond. And then, of course, we have partners like Standard Chartered, DBS, Latham & Watkins, Sherman & Sterling, and the list goes on, and various UN bodies who are all part of, I would say, the various process of the creation of the Women's Livelihood Bond. So it's really a beautiful effort to bring in what I'd like to say, the SDG 17, the partnership of public, private, and the civil society and the philanthropic bodies. So we are very proud that all these people could come together to create it. So moving on to the next slide. So in terms of the current situation of COVID, interestingly, what we are seeing is when the COVID hit a few months ago, this was, I would say, the true testament of how the companies who are actually doing sustainable work and actually working with underserved communities, how it was a testament of their work in showing that the work actually continued. So for us, all our investments and all our investment vehicles and portfolio, they all did absolutely fine. Not that, it's not tough for them, it is, but they are committed to continuing the work they're doing for the beneficiaries and with us. So we are extremely proud that the livelihood bonds is a part of that, and all the payments are being made and the bonds are actually doing absolutely fine. As a matter of fact, it was very heartening for me to get notes from the Women's Livelihood Bond investors. Literally, someone sent me a screenshot of the Bloomberg screen of Women's Livelihood Bond. And this investor, literally I'm quoting him, he said, the market is down by 30% and our WLB is up by 3.85%. So thank you so much. So again, it's not thanking us, but really thanking the women who are working so hard. Basically from the first one, we had 385,000 women where the livelihood was created, and the next one was 250,000 women. So nearly 600,000 women who are working so hard for this bond and making the payment. And we are so proud that this work continues, even during the COVID time. And perhaps it is, again, the testament that if you really are sustainable, if you're really working with the people, that the work actually speaks for itself. So it is very rewarding in that respect. And in terms of looking at the Women's Livelihood Bond 3, we are deep into our work, and it's very, very interesting. A lot of people asking us, how are you doing it? I mean, you can't go to the field, how are you actually working? Well, we were actually very fortunate that we have created a lot of technology solution, before we started working on the bond. So our digital solution is we have a COVID tool to actually figure out the resilience, of the potential portfolio. We have the digital due diligence kit that we have put together. And all of this, again, we're happy to share with others. And then most importantly, we also have digitized our impact assessment with the voice of the women as a part of it, where they actually verify the impact that these organizations are creating, which will be part of the bond. And through them, of course, the funding will go, to these women. So WLP3's focus really has been in terms of being responsive, being resilient, and then really being, resistant, to basically the COVID disruptions. So we have been able to really be an active part in creating a bond that has organizations which are actually doing this work in terms of the healthcare, being responsive immediately through the outbreak, who are actually being resilient because, again, as COVID is happening, we have to be cognizant of the fact that the economies have to keep growing and we have to have the basic needs met in terms of food, in terms of energy. So all that work needs to happen and the financing needs to go in for that. And then in terms of course, the being resistance, really accelerating the recovery. So really having technology focused on women, having insurance as a part of the whole solution. So we're looking at every angle to make sure the Women's Livelihood Bond 3, the portfolio, really covers this gamut. And as the portfolio is being now put together, it actually looks like that is going to happen. So that is, we're actually very excited about that. The next slide, please.
You have 1 minute left.
Yes, this is the last slide. So basically, in terms of the bond as we are creating it, a big component of that is really the structure. And this is where the Women's Catalyst Fund comes in. And this is where we are really pleased that the Taiwanese government is looking to play a role, where it will actually work as giving the first loss capital and also the warehousing facility, for the loans that will be made. So again, without going into details of it, it's a great leveraging factor in terms of opening up, more capital in the market. Next slide. Next slide, please. Yeah. So I think I always like to end with something that what you can do as a listener, as a part of a solution of using the financial markets. So if you have women-focused enterprises who need financing, please contact us. If you want to support a COVID resilient bond and actually do something positive with the financial markets, for COVID, once again, you should be looking at the Women's Livelihood Bond, which is going to go out to the market, the next one. And then if you want to learn more about actually one of the incredible leverages that you can have, you can be part of the Women's Catalyst Fund. So once again, thank you to all of you. Thank you again to the Taiwanese government. Thank you to ICDF. And, really pleased to be part of this conversation. On to you, Yanis.
Thank you so much, Professor Sanas, for your inspiring presentation, how to include women, value women, empower women. The Women's Livelihood Bond really shows that it's possible to create a financial mechanism that is a win-win situation for both the investor and the borrower, and that it doesn't matter that we are in a COVID situation, that these could actually be COVID resilient. So women are largely affected by the increased inequalities due to COVID-19, but they are not the only ones. Lockdowns had an important public health purpose, which was to stop the spread of the virus and flatten the curve. But it also had disastrous consequences on people who could not work from home. So our next speaker will discuss how to use STIs to mitigate the economic impact of COVID-19 using the example of Paraguay. I want to warmly welcome Mr. Fernando Rivarola. Fernando Rivarola is currently the main advisor to the Minister of Finance of Paraguay. He works closely with the Minister of Finance and coordinates the technical unit of the cabinet of the minister, which includes management of important national projects. Previously, he worked at the Central Bank of Paraguay as technical analyst in the Economic Research Department, where he also actively participated in projects such as the National Transparency Strategy. He has a master's in public management and economic law from the University of Salamanca in Spain, and a master's in public administration and economic policy from the London School of Economics. Mr. Rivarola, the floor is yours.
Thank you very much, Yanis. Good morning, everyone. my fellow speakers, and the whole audience. Thank you very much for the opportunity of being here presenting some of our work we have been performing here in Paraguay. Today, I'll be speaking about the economic impact of COVID-19 in Paraguay and the mitigation strategy that we aim to implement in order to achieve a quick recovery. Next slide, please. I try to divide this presentation in three. Firstly, I will be introducing and giving some context on the pandemic in Paraguay and some data about our economy. Secondly, I will explain how our economic background allowed us to take immediate action to the emergency. And lastly, I will present the recovery plan for the upcoming months and the next year to mitigate the pandemic economic consequences. Next slide, please. As Dr. Siqueira explained earlier, Paraguay is still resisting very well to the health impact of the pandemic. Our main focus relies on contagion containment, which I consider has been a success so far. As you can see, Paraguay is among the lowest number of infections per million people, and not surprisingly, you can also see that Paraguay has the lowest number of deaths per million people, well below Brazil, Chile, Argentina, Peru, Ecuador, and others. Next slide, please. However, as everything comes at a cost, this good health performance has had its devastating economic impact. The lockdown started in the first days of March, which led to an unprecedented drop in economic activity. If we compare real GDP growth projections from 2019 and this year, 2020, the estimated GDP loss for the year 2022 will be around $18 billion. Next slide, please. However, according to different sources of forecast, although Paraguay is going through a deep recession, and it will not be as deep as other countries of the region, our economy is expected to have a 5.1 drop in GDP, below Chile, Colombia, Brazil, and well below Argentina, Peru, and the South American average. Next slide. Well, why is that? Mainly because Paraguay entered this crisis with sound fundamentals and sustained economic growth. For the last 10 years, we have had an average GDP growth of around 4%, well above Latin American, Brazilian, and Argentinian average. Next slide. In the last decade, and even during this crisis, one of our priorities is to maintain solid macroeconomic foundations. Our international reserves as a percentage of GDP are among the highest in the region, and our external debt has not even reached 30% yet. Next slide, please. So I'll go quickly through the immediate economic reactions to the pandemic outbreak. Next one, please. As a developing country, our only way through the pandemic was debt. So last year, our primary balance was positive. And as explained earlier, our debt to GDP ratio is among the lowest in the region. Even so, the fiscal package adopted to face the emergency is around 2.8% of our GDP, which is very close to the Latin American average. Next slide, please. Despite the huge effort regarding the fiscal package, and it is expected that our balance deficit for 2020 will be around 5% of our GDP, but we're not presenting a twin deficit as our current account is still expected to be positive around 1% this year. Next one. As a first measure to alleviate the impact to Paraguayan taxpayers at the outbreak, major taxes collection were postponed for at least 3 months, which implied a tremendous drop in the state revenues. Thus, we went out to international markets and multilateral agencies to obtain around $1.6 billion to mitigate the immediate health, social, and economic impact. Around 500 million were given to the health system, which still has a low execution, unfortunately, but they're in the mean to improve. 530 million went to the state functioning, wages, debt service, and social programs, and around 426 million went to social protection through direct cash transfers. This program benefited more than 2 million people, and it was an unprecedented program in the country. It was built in less than a month, and it was an important challenge to overcome was that vulnerable people do not have access to formal financial systems. And thus, technology was our biggest ally to reach them through personal e-wallet and what is called the ID debit card, which allowed them to do their groceries with their personal IDs. Next slide, please. And now I will talk about the most important part, the most exciting one, the medium and long-term mitigation, which we call here the recovery plan. Next slide, please. Our government strategy has 3 pillars, which are social protection, investment for employment, and credits for development. And transversally, the state transformation. Next slide, please. The first pillar is the social protection, and this component has an investment of $861 million. The most important program is P2VO, which is $250 million. It is a direct cash transfer to those economic sectors that were mostly affected by the outbreak. Within this sector is the commerce in the frontiers, because we still have our borders closed. A very important aspect of our economy is based on commerce with our neighbors, Brazil and Argentina. As long as frontiers are closed, this commercial sector is suffering. So they are our main target, as well as other sectors as restaurants, bars, hotels, and cinemas. Around $50 million are targeted to vulnerable elder people, and around $100 million are to strengthen the health system and the pension system in Paraguay. Next slide, please. Our strategy also has a business and labor reconversion approach with programs that will focus on reorientation and capacity building for labor skills through the labor ministry, fostering entrepreneurship and innovation, and improving the business climate by simplifying steps to open a new business. All this within 3 key sectors that have been identified, which are creative industries and ICT services, e-commerce and courier from especially for the frontiers, and agribusiness with added value and regional logistics. Next slide. The second pillar involves $1.4 billion of public investment just for the second half of this year, 2020, generating more than 120,000 direct and indirect jobs. The total investment for 2020 would reach around $1.8 billion of public investment in public works. Next slide, please. Within this second pillar, another transcendental component is the electronic government, the e-government, through the ICT ministry. With a plan for the next following months, we will strive to have more than 2,000 public schools with internet broadband connectivity, new system for public management and operations through electronic files, setting up new ICT equipment or health centers, among others. Next slide, please. And the third pillar is to capitalize public funds, providing financing mechanisms to address credit market constraints and provide more liquidity to people. Among these programs, I can mention long-term funds for private investment, guarantee funds for housing, compensation funds for micro, small, and medium enterprises, and credits from the development agency, among others. Next slide. So, for 2020 and 2021, the total recovery plan within its 3 pillars will sum up to $2.5 billion. Next slide. Lastly, but not least, and I would say the most importantly, to finance this huge fiscal package, it is necessary to address profound structural changes within the state. This government has set 5 big transformations priorities. All of them are linked to the SDGs, which are perfectly aligned with our national development plan. These 5 areas are the transformation of the educational system, the national strategy for innovation, the reform of the health system, the new civil service law based on access and career development, and the reform of the public structure and the public administration. We have no doubt that science, technology, and innovation are going to be our strategic ally to complete such an endeavor. Thank you very much, and I'll be more than happy to accept your questions.
Thank you so much, Mr. Rivarola. So this officially concludes the panel sessions, and in the interest of time, we have about 11 minutes left. We're going to jump immediately in the Q&A. We probably have about 5 minutes to do that. So I'm going to select some of the questions that you have been sending on the various platforms. And I want to invite Dr. Philippe Lowe first to please switch on your camera. There's a question for you. So more and more countries have decided to reopen their society for economical reason and not because they were able to beat the virus. If these countries become a majority of the countries, what impact do you think this is going to have on countries that were able to suppress, like Taiwan or Paraguay? That's the question.
So we have recently seen examples such as Japan, Korea, Thailand, and Australia. They have been able to suppress the epidemic domestically, but after opening up, either due to a breach in quarantine management or a breach in entry screening, so somehow community spread occurs again and affects the community heavily. And it's actually very dangerous for those well-controlled countries to experience a second outbreak, because this will trigger mistrust among the public for the government's management. So in Taiwan here, we are very cautious about opening our border. So we are taking a very judicious step-by-step looking at other countries' experiences. Now, I think one of the most strict countries in the world is New Zealand. They still close their borders to non-citizens, and they always have a capacity consideration in terms of how many people can be allowed to enter the country. And to another extreme is like European countries that have opened their border to a bigger degree, and the United States also there. So we are looking at various examples and see where we can go in this strategy, combining our current digital technology and the testing capacity, and just decide where to go next. But I think the first priority is to protect our people from getting domestic outbreak and to prevent community from getting into the bad situation of lockdown. Thank you.
Thank you. It's a very difficult decision, actually, because on the one hand, you do want to protect the nationals, in the case of Taiwan, for example, but you also understand that this is such a globalized world now that you cannot really live independently forever. You can do this for a certain number of time, but countries that are dependent on tourism, for example, will heavily suffer if, even if they have suppressed the virus domestically, they will at some point need to open their borders again in order to let the tourism flourish. So it is a very difficult decision to make. Thank you so much. Okay, so my next question is to Dr. Lee from Taiwan ICDF. The projects have been tailored to the COVID-19 pandemic, but could you see your project being applied to other situations or implemented more generally in the future? Is STI a trend that you would hope to pursue in the post-COVID world?
Okay, thank you for the question. So, the STI is definitely a trend and a tool which cannot be ignored in the post-COVID-19 eras. The digital engineering will be a basic skills when the Taiwan ICDF provides STIs education environment to primary school and secondary schools in developing countries. The digital capacity will be built, and the student will not be left behind by the modern world. Under the concept of big data and open data, the STIs will be applied to smart agriculture, health system, environmental conservation, and economic development. For instance, the tracing system for COVID-19 can also be applied for monitoring dengue fever, flu, and even chronic disease as well. Thank you. This answer.
Thank you, Dr. Lee. Okay, so I have a question for Ms. Please turn on your cameras while I read the question. How do we protect children from screen and tech addiction, viewing unauthorized content and their negative effects on the children while we are going now on this quest of e-learning? do we still have Ms. Soriano or Mr. Hawk on the webinar?
Yeah, I'm here. Okay, so we often hear about the concern about security of the children, whether those are safe internet. There are different projects that deal with the preparation of children, how to use safe internet. But if you look at the fourth industrial revolution, which will be highly tech based, and many of the manual job will be obsolete, and many people will lose the job. We need to prepare our future generation to fight in the job market, to fight in the global industry. And we need to prepare. We need to have kind of outlook, that mindedness that will face the future, not to protect. If we protect, actually we'll be loser. We need to, whoever adopt the technology first, they will get more benefit out of it. But we need to regulate it. We need to give a congenial environment that will help us grow and help our children to learn better. Thank you.
Thank you so much. Very true. Okay, so unfortunately, this already concludes our Q&A session, because I do want to give time for closing remarks to our next speaker. I want to thank all of the speakers for their really brilliant contributions today. If your question has not been answered, and I know that there were many that have not been answered, we promise they will be available on the Taiwan ICDF website within a few days. We will send them to the various speakers that you have asked the questions to, and we will collect their answer. So it is now my absolute privilege to introduce our final speaker, Ambassador Lily Xu, who is the Director General of the Taipei Economic and Cultural Office in New York. Ambassador Lily Xu is the Director General of the Taipei Economic Cultural Office and head of the UN Affairs Task Force in New York. She is a seasoned career diplomat with more than 30 years of experience in the Foreign Service. Prior to this position, she served as an ambassador of the Taiwan Embassy to Denmark from 2012 to 2015. She was also a senior official of the Chinese Taipei in APEC, where she served as Director General of the Department of International Organizations of the Ministry of Foreign Affairs of the Republic of China. She was also posted in the UK and Washington, D.C. in the United States. Ambassador Xu, the floor is yours.
Thank you. Hello, everyone. Well, a big congrats to everyone. We just concluded a fruitful webinar. I want to first thank our co-host, Taiwan ICDF, and the Columbia University's Center for Sustainable Development, as well as all the speakers from different continents, different time zones, and our moderator, of course, good friend, Yanis. Thank you for sharing your inspiring experiences and insights. COVID-19 has caused enormous impacts on almost every aspect of human life, and they have challenged our global institutions, every government's capability of governance, civil society's resilience, and so much more. With vaccines still on the way, we are all forced to learn how to cope with this new normal. And we not only just want to cope with this crisis, but also want to build back better. As the theme of today's webinar shows, emerging stronger after the pandemic. From today's discussion and sharing, we've learned various science, technology, innovation measures that have been used to respond, to mitigate, and to recover, as with the SDGs as the roadmap. However, we are also reminded that for the most vulnerable communities and least developed countries that are hit the hardest, science, technology, innovation might not be accessible and applicable. Hence, public-private partnership and international cooperation are all the more important. As I'm so sorry. There's some technical disruption, obviously. But I think I've taken too much time for everybody for waiting. So let's just stress the last part. We need to work smart, which means using this technology. Obviously, we need to improve that. And science, innovation measures creatively. Can everybody hear me now?
Yes, we can hear. I can hear you.
Yeah. And I think we need to work together by expanding and strengthening partnership. I think everybody stressed that partnership and work smart. Taiwan is willing to commit to work with everybody hand in hand. And we are strong in science and technology innovation, and we are committed to doing our part. We hope that being a trustworthy partner in this global fight against the pandemic, we can expand our partnership and work together to build back a better world for all together. Thank you so much, and I apologize for the disruption. Hopefully, ICDF can do a good job to editing it and makes this. Just want to congratulate everybody and wish everybody and your loved ones stay healthy and safe.
所以我们要结束。
Yanis, are we concluding this already? Yanis, can you hear us?
Is it okay? Okay.
Yes.
Thank you for Ambassador Xi. Also, all the presenter tonight. You know, it's a very perfect resource about this the video conference does. I think the emergence stronger after COVID-19. The science, technology, and innovation for sustainable development. It's just based on the sustainable development goals implementation. You know, the COVID-19 will affect the global people and the economy. But we think that it could be the recover in the near future. I think it's more important for the post-COVID-19 for all the economic recovery, very significant and important. Thank you for Yanis and all of our presenters. Have have a good days. Some people have a good night, and for everybody, see you next time. Thank you very much.
Thank you, Dr. Lee. Just final words. If you like the event today, please look on the Colombia CSD website for similar events, csd.colombia.edu, as well as Taiwan ICDF website for any upcoming events that they may have. Thank you again to all of the speakers, to Taiwan ICDF for organizing, and TECO for co-organizing. Wish you all a lovely day and evening. Bye-bye.